Right now, local governments across the entire nation of Indonesia are actively preparing to terminate thousands of essential contract workers. The wave of dismissals is a direct response to new national budget efficiency mandates handed down by President Prabowo's administration. The targeted workforce consists largely of PTPK. PPPK, or Pegawai Pementar dengan Perjanjian Kerja, is a category of government contract workers who serve in essential public roles without the lifetime tenure of traditional civil servants. What was designed in Jakarta as a strict spreadsheet adjustment to rein in spending is quickly triggering a massive unemployment crisis in the regions. To understand why this is happening, we have to look at the provincial and municipal governments where these workers are actually employed. This chart illustrates a typical local government budget, or APBD. APBD is the annual financial plan of regional governments in Indonesia. Notice how the bar for personnel spending is suddenly cut down by a strict legal ceiling known as the UUHKPD. UUHKPD stands for the Law on Financial Relations between the central and regional governments, a mandate that enforces a hard mathematical cap on how much a region can spend on its employees. When that legal cap comes down, the remaining budget space shrinks immediately. Local governments lose the fiscal room required to pay their current roster of contract workers, forcing those positions off the payroll entirely. Regional mayors and governors are not initiating these mass layoffs out of a desire to shrink their workforce. They are legally compelled to cut staff to comply with central legislation. The most immediate consequence of these cuts falls on frontline education. Thousands of these contract workers are public school teachers handling daily classroom instruction. The secondary wave hits the healthcare sector. Regional clinics and hospitals rely heavily on contract nurses and medical support staff, who are now facing termination. This diagram shows the staffing levels in both sectors plummeting below a critical service red line. Without enough teachers in classrooms or nurses in clinics, the delivery of basic community services will halt. Enforcing absolute budget efficiency at the national level creates a direct, mathematically unavoidable cost to the health and education of the regional population. This visualization represents the first major policy dilemma for the Prabowo administration, weighing strict central fiscal discipline against massive regional workforce instability. The growing crisis has prompted immediate intervention from the DPR. The DPR is the People's Representative Council, Indonesia's national legislative body. Lawmakers are currently demanding the central government apply discretionary budget exceptions to prevent local service collapse. The proposed solutions on the table are straightforward. The government can allocate special discretionary funds, provide targeted budget cushions for priority sectors, or accelerate the transition of these contract workers into PNS. PNS stands for Pegawai Negeri Sipil, the permanent civil servant status that guarantees state funding and job security. The administration must now decide. They can strictly enforce the spending caps written into the law, or they can intervene to save the jobs of the frontline workers who keep regional services running.